We're back with Amy Rivera, who lived with an extra 35 pounds on her leg, which went misdiagnosed for most of her life. Joining us now is Amy's surgeon, lymphedema and lipedema surgeon, my friend and colleague, board-certified plastic surgeon and professor at UCLA, Jay Granzow. Dr. Granzow, Jay, welcome back to the show.
Hi, Drew. Thanks for having me back. It's an honor.
So tell us, what is lymphedema? How common is it?
Lymphedema is really underappreciated in the United States. Over 10 million people have it. That's more than ALS, MS, Parkinson's disease, AIDS put together. So there are a lot of people with lymphedema, but why do doctors fail to diagnose this all the time? I mean, it's really crazy, but in a 4-year medical student's curriculum, they might get less than 1 hour of training. So that's why, for example, Amy might have had different diagnoses and no one knew what was going on. Plus, swelling in the legs is also incredibly common for reasons such as venous problems or blood clots in the legs, etc. What's really frustrating too is that most lymphedema in the United States actually isn't even congenital. It happens after cancer treatment. So if you have lymph nodes removed or radiated in the proper treatment for breast cancer, GYN cancer, the chances of getting lymphedema are pretty significant. And those things happen as people. So breast cancer and arm lymphedema, in Amy's case, she has a leg lymphedema. Lymphedema is a disorder of the lymphatic system. So and that's part of the immune system, which allows for circulation of a fluid called lymph. It's your cleaning fluid. It sweeps your body and clears out bacteria. It clears out cancer cells that your body's creating and wipes them out all the time. But this stuff is really toxic. Think battery acid, think lighter fluid. And if this starts to back up, it causes swelling like a wet Nerf football. That is going to make you feel wiped out. So Amy's symptoms are quite common for people with lymphedema. It's going to make you feel like you have a hangover because your body is processing all this toxic stuff all the time, and it's sitting and sticking in your leg, in her case. And what that does is it damages those tissues around it. So your skin starts to get really thick and boggy. Your lymphatic drainage system itself starts to break down. Your arteries, your veins, your tissues, they all get worse, and you eventually have permanent deposits of additional fat and protein, which you can't get rid of without surgery. So you go from something that's a fluid predominant issue, which we could treat with some therapy, into something that really there's only a surgical solution. In Amy's case, she's congenital. That means that her lymphatic system had a birth defect that on its own wasn't able to clear that fluid. So as she got older, her system got worse and worse and worse. That toxic fluid made things even worse than that. And her skin got so thick, it was probably 5 centimeters thick by the time we got to surgery. And by the time she got to me, she had had all this scarring. She had had 2 failed procedures before, so she was a really tough case. We took out over 8,000 cc's of aspirate, meaning solids that come out. That's just solids after we've expressed some of the fluid with good therapy before. Afterwards, and her skin was so damaged that I actually had to remove some of that skin just to get things down, which happens in less than 1% of the cases I treat. Normally, the skin shrink wraps afterwards and goes down on its own. So it really comes out in an impressive way, but her skin was so far past that we were able to handle that, bring things down, and then do it in a very consistent and a reproducible way so that when we take those bandages off in the hospital, she can get that result and see that knee and see that leg and start walking right away. It's really fantastic.
Well, I see you getting excited for that moment when her bandages or dressings came off, as it was for Amy.